Hello everyone. Today we will discuss on survey procedures. Coming to the introduction, survey is a non-experimental type of research that attempts to gather information about the status quo of a large number of people by designing the present condition without directly analyzing their cause. Survey is defined as a systematic method of collecting information through non-experimental investigation. The purpose of most survey is to collect information that will provide the basis of action. Coming to types of survey, we have descriptive and analytical surveys and cross-sectional and longitudinal surveys. Descriptive surveys will describe a situation and analytical surveys will explain a situation. Whereas cross-sectional surveys provide information of a situation that exists at a single time. Longitudinal surveys provide information of a situation during a period of time. Coming to the uses of survey, the survey helps in monitoring trends in oral health and diseases, helps in developing policies, assessment of dental needs, helps in program evaluation, and also provide visibility for dental issues. Coming to the steps in survey, there are 7 steps in survey. It starts with establishing the objective, designing the investigation, selecting the sample, conducting the examination, analysis the data, drawing the conclusion, and publishing the result. Coming to the first step, which is establishing the objective. The investigator must be absolutely clear about the objectives of the investigation. The objectives can be of two types. It can be stated as a hypothesis to be tested, and also it can be stated as describing what is to be measured. The second step is designing the investigation. In designing the investigator has to prepare a survey protocol. A survey protocol is a written document of survey which should contain the objectives and purpose of the survey, a description of sampling method used, personnels and physical arrangements, statistical methods, a timetable of the activities in the survey, approval forms, budgeting, and emergency care and referral. Coming to selecting the samples, we have universal population and sample population. We will obtain the sample population from universal population through the process called sampling. Sampling is the process or technique of selecting a sample of appropriate characteristics and adequate size, which we will be doing from the universal population. Next step is conducting the examination. Before conducting the examination, the investigator has to schedule the examination timing, has to arrange the instruments, have to prepare the infection control methods, have to find out the examination area. He should calibrate the examiners and should confirm the type of examination which he is going to do. So coming to calibration of examiners, the calibration of examiners can be done by using an index called kappa stat 6. It is used to calculate the inter and intra examiner reproducibility, and it is an index which compares the agreement against that which might be expected by chance. The value ranges from +1, which is perfect agreement, via 0, which is no agreement above that which expected by chance, to -1, which is complete disagreement between the examiners. After conducting the examination, the next step is analysis of the data. Analyzing of data can be done by using statistical methods, and the result which we got from the statistical exercise can be used to interpret the result. Once we got the results, we have to draw the conclusion. It should be based on the result which we obtained. And we also have to give recommendation based on the results which we got. After all that things, we have to publish the report. So these are the 7 steps in survey procedure. Now comes the types of examination. We have 4 types of examination. It includes type 1, which is complete examination, type 2, limited examination, type 3, inspection, type 4, screening. In complete examination, we will use all the non-instruments and methods which are available in dentistry to examine the patient. In limited examination, we will be using the light source examination instruments, that is diagnostic instruments, x-rays, and it will be done in a clinical setup. In type 3, we will do inspection, which we are used to do in camps. There, we will be having a chair and a light source. In type 4, which is screening, in screening, we will be using a tongue depressor for examination, and there will not be a particular light source for examination. We will use the available light source. So, while doing a survey, the examiner should determine which type of examination he is able to do. Coming to basic oral health surveys, the basic oral health surveys are used to collect the information about oral health status and the treatment needs of a population, and subsequently to monitor the changes in levels and patterns of disease. Coming to Pathfinder survey, which is the most commonly used basic oral health survey, it is a stratified cluster sampling technique which aims to include the most important population subgroups likely to have different disease levels. It is classified into 2 types. One is pilot study and national Pathfinder survey. Coming to pilot study, it includes only the most important subgroups, only 1 or 2, usually 12 years and one more age group. Only minimum amount of data will be collected in pilot study. Next is National Pathfinder Survey. In National Pathfinder Survey, we will cover all the important subgroups, likely from 5 years, then 12 years, 15 years, 35 to 44 years, 65 to 75 years. So, 5 years is used to assess the dental caries in primary dentition. In 12 years, we will be examining the global monetary age of dental caries. 15 years, it is used for periodontal age indicators in adolescents. 35 to 44 years, oral health conditions can be checked in that year. In 65 to 74 years, obviously, for geriatric population, where their oral health status will be examined. So, this will conclude the chapter. Thank you.